Have you ever felt a bit warm, just not quite right, and checked your temperature only to find it slightly elevated? It can be perplexing when you feel unwell, but there is no obvious cause like a cold or flu. For people with lupus, the kind of fever most commonly associated with the condition is a low-grade, persistent fever without any clear infection. This means your body temperature might be slightly elevated, often below 100.4 degrees Fahrenheit or 30 degrees Celsius, and it can linger for days or weeks. The reason behind this type of fever in lupus lies in the very nature of the disease. Lupus is an autoimmune condition, which means your immune system mistakenly attacks your own healthy tissues and organs. This ongoing, systemic inflammation throughout your body can trigger a fever as a response. Think of it like your body's internal alarm system going off. It is not necessarily fighting an external invader, but rather reacting to its own internal processes. This makes lupus fever distinct from a fever caused by a bacterial or viral infection, which typically causes higher temperatures and more acute symptoms. If you have lupus and notice a persistent low-grade fever, it is important to observe it carefully. Keep a record of your temperature, how long it lasts, and any other symptoms you are experiencing, such as fatigue, joint pain, or skin changes. Do not try to self-diagnose or ignore it. Instead, communicate these observations clearly with your healthcare provider. This detailed information will help them assess whether the fever is related to lupus activity, a potential flare, or if there is another underlying cause that needs attention. One of the key things to understand is that these low-grade fevers can sometimes be an early indicator of increased disease activity or an impending lupus flare. And like the sudden, high fevers that often accompany infections, a lupus fever might creep up gradually and stay in that mild, but bothersome, range. It is often referred to as a fever of unknown origin until other possibilities are ruled out. Recognizing this subtle signal can be incredibly empowering, allowing you and your medical team to potentially adjust your treatment plan and manage symptoms proactively. Understanding the nature of lupus-related fevers helps transform a confusing symptom into a valuable piece of information. By recognizing that a low-grade, persistent fever could be a sign of internal inflammation, you can work more effectively with your doctor to interpret your body's signals and take timely action. This proactive approach supports better management of your lupus and helps maintain your overall well-being.